They were some of the most vulnerable people in the country. 40 people with a learning disability or autism who died while admitted to an NHS programme that was supposed to protect them. We don't know all of their names and we don't know all of their stories, but now, for the first time, 2 families have spoken out about a system they believe let their loved ones down. Amanda Brierley was autistic. She was just 20 when she took her own life on a mental health unit in 2016, hours after returning from a Christmas home visit.
We got a phone call early hours of Boxing Day morning to say she'd been taken to the LRI.
Leicester Royal Infirmary. And she was in a serious state. And eventually, on the 28th of December, they said that, her organs were failing and therefore they had to decide whether to turn the machine off.
Amanda had a history of self-harm, but she should never have been on a mental health ward because it was unsuitable for people with autism. In this interview recorded for the NHS Trust in Leicestershire that was managing her care, she explained why.
So when someone's upset that, that they say they're banging their head and the pin's been pulled and they're shouting and screaming, I'm genuinely upset because of the loud noise. Loud noise goes on for a while, sudden loud noise. B, I can hear people, hurting themselves and in distress, and that makes me feel in distress.
Amanda had been waiting 7 months to be transferred to an appropriate facility under an NHS programme called Transforming Care. On her last night, she was supposed to be under one-to-one supervision to stop her hurting herself. One of several failures in care her inquest heard was unacceptable.
I think we all knew all along that it was never the right place for her to go, but there was nowhere else to go. And she was in crisis and needed to be somewhere where she could be kept safe.
We really need to get resources together to understand, if somebody's got a need and they need to go to a specialist place, those resources need to be easily findable.
More than 2,000 people with learning disabilities and autism are currently in institutions waiting to get the appropriate care they need and that the NHS has promised. Clive Treacy was one of them.
Clive was the life and soul of the party.
He could have gone on forever.
He had a learning disability in epilepsy and spent most of his life in care homes and hospitals.
And the aircraft couldn't have been any bigger, could it?
No.
He was not autistic, but he was in an autism unit 50 miles away from home when he had a seizure in 2017.
When my phone rang at 7 o'clock in the morning, I didn't realise it was my brother. She said, "Your brother's dead." I would never wish on anyone the cold, empty delivery of my brother's death on anyone. He never came home. We brought him home the day laid to rest.
This CCTV footage screened at Clive's inquest shows staff trying to revive him. The inquest was told they had only basic first aid training and that a machine that helped him breathe at night was broken. The inquest ruled Clive died of natural causes, but his family believes years of inappropriate care and inadequate support contributed to his death.
How can a system in this day and age not support an individual that shows a lot of clear signs? Clive's disabilities were not as severe as some individuals unfortunately have. Clive wasn't autistic, but he lost his life in an autistic facility.
When Sky News first revealed that 40 people had died in the Transforming Care programme, the government promised an NHS review of every death, and the Care Minister said this.
As it stands, Mr Speaker, there is no indication that any of the deaths were untoward or that due process was not followed in every single case, but we are double-checking each and every one.
But 4 months on, the review is still not complete, and Labour's shadow care minister says families need answers now.
The treatment of autistic people and people with learning disabilities in these sort of units, these assessment and treatment units, is a national scandal. The response we got back in October when I raised this issue was that, oh, well, there's nothing untoward about these deaths. I think your continued research and examination of these issues is showing that there is.
The NHS says that all these deaths will be reviewed, and in future all fatalities will be examined as a matter of course. But while the Department of Health says the care of people with learning disabilities and autism is a priority, a target to move at least half of people out of institutions into community care has been pushed back 5 years. And in many places, cuts to local authority budgets mean that care simply doesn't exist.
Dear Lisa, can you help me find a new home? Thank you.
Dan Shell, the private care provider that ran the facility in which Clive died, said staff were saddened by his death and extended their sympathies to his family, but said they could not comment on individual patients.
Love, CT.
A letter he didn't get to post?
No.
What I, and I know the family, would like to see is that justice is given for Clive. We find the truth, that we can conclude, that people can say, we made errors, but we've learnt from it and there won't be another Clive Treacy case.
I think Amanda would be quite proud of these, don't you think?
No, it's not enough colour.
Leicestershire Partnership NHS Trust have apologised to Amanda's family and say they've made changes to systems and staff training.
I just feel sad that we've lost, you know, our potential future with her, haven't we?
Yeah, yeah.
Our potential future. And just hope that, you know, nobody else has to go through this.
Yeah.
We are all individuals. I just say never assume, just listen. That's all I'd ask for you to do, is to just listen.
Amanda's is one voice among many. Families want them to be heard. Paul Kelso, Sky News.